Now, in short, pacemakers are implanted in patients who have a very slow heart rate or rhythm, which causes symptoms or affects their quality of life. Typically, pacemakers are very simple but yet sophisticated devices which are easily implanted under local anesthesia in this particular area. Some people also implant it on the right side under the skin. It's a very simple procedure under local anesthesia, usually by and large with minimal pain, and once implanted successfully, it remarkably treats or improves the patient's condition and their overall well-being. For sure, they can be removed, but in majority of the cases, there is no reason or there is no need to remove unless there is an infection which is untreated, which is typically a pus or a fistula which is noted at the pacemaker side, and a less common reason could be the pacemaker wire leading to a leakage of the valve, which can be very nasty sometimes to treat. Unless we have these two situations, a pacemaker doesn't need to be removed even though the pacemaker is not active in the patient's rhythm. Yes, we do it all the time. In the hierarchy of pacemakers, we have basic pacemakers, which are single chamber pacemakers. Then we have dual chamber pacemakers, cardiac resynchronization therapies, defibrillators, and conduction system pacings. All of them have their own roles depending on the patient's condition, patient's heart function, patient's age, patient's chamber of interest where we need to pace. All these devices are contemplated. And if the patient has a lower model, or we assume or clinically deem it as an inferior model or an inferior mode of pacing, we often advise and do execute upgradation of pacemakers, wherein we go to a better mode of pacing, which may include the insertion of one or more leads and the change of the pacing device. So yes, that is called upgradation of pacemaker, which could be from a single chamber to a dual chamber device, from a dual chamber device to a CRT or conduction system pacing. We do it all the time, and the entire objective is to maintain and improve the underlying heart function with which the patient is going to live longer, live better. Thank you.